Hi there, Dr. Carri Dominic, pelvic floor physical therapist, and let's talk about, can I lift weights if I have a prolapse or bladder leakage? The answer is yes. So number one, I would always recommend seeing a pelvic floor physical therapist and working with them on your particular case. But so often patients come to me, especially for prolapse, and the doctor, the OB, has told them that you can't lift weights anymore if you have a prolapse. It's dangerous for your prolapse. And that's very old school thinking. A couple scenarios, like think about, what if you're a new mom and you have a baby? You have to lift your baby and their baby carrier and their diaper bag like a billion times a day. You can't not lift weights. You have to lift your groceries, your laundry detergent, like all of those things are weights. So you can't tell people not to lift weights. Also, I've had professional weightlifters come to me because in their annual pelvic exam, the doctor told them like, oh, you have a prolapse, you shouldn't lift weight. And they were like, but this is what I do, like competitively, like for fun. So it can be done. There's just a couple principles that I usually go over with people. And so the same thing kind of applies for anyone with bladder leakage too. Like, nobody's telling these patients with bladder leakage not to lift weight. They're just saying like, oh, that's just, you have to live with it. But you don't. There are strategies. So let's go over some of them. So the main cue that I give people is breathing. So we're going to use squatting as an example, and I'm going to use a kettlebell. And so what I tell people with squatting is to inhale on the way down and then exhale on the way up. So this is not super heavy, so it's pretty easy for me. But as things get heavier, we want the pressure to go away from the pelvic floor. So inhale and then exhale. Let me set this down so I can explain. So we want to exhale on the hard part. So let's say I'm doing something else. I'm doing bicep curls. So I'm gonna exhale, inhale, exhale, inhale. Same thing with any exercise. We could think about shoulder press. We could think about bench press. Right? But it's especially important with upright activities such as squatting, where the weight is more directly on our pelvic floor. And so if we're breathing on the hard part, we're sending the pressure up and out, versus if we're holding our breath, then the pressure is going more straight down. So this is not for 1 rep max lifts. Obviously, this is for, a more moderate lifting strategy. If you're going for 1 rep max, that's a different strategy. But again, this is probably the most vulnerable for the pelvic floor. So if we have prolapse or if we have bladder leakage, we're going to try to send some pressure in the opposite direction. So it's going to be, inhale, exhale, and the other thing I tell people too is if you have bladder leakage or a prolapse or something with the pelvic floor, a sumo squat, something like wide-legged, is gonna feel really vulnerable here. So that's maybe not the best exercise if you have those symptoms. Again, early on, hopefully over time your pelvic floor gets stronger and you can do these things, but early on, like maybe a more narrow stance squat is better. It doesn't have to be narrow, but like something more comfortable, versus a sumo squat is just really wide open. So there's some things to think about. Also, work with a pelvic floor therapist on any specific needs. If you have weakness, very often in prolapse, I find my patients have tightness of their pelvic floor, and once we can release that, then their pelvic floor gets stronger. There's a lot more nuance to it, but that's like, I just want to share some general strategies that you can exercise, you can lift weights with prolapse or bladder leakage.